Today we are going to module 7, and this is module 7 of medication management for patients and caregivers. And module 7 is medication management for chronic conditions. And as usual, it's presented by me, Olufemi Williams. And our community, you can join our community at school.com/mywebpharmacist. So at my web pharmacist, we support women and men 40 plus in safely managing theirs and their loved ones' medications, minimizing risk from side effects and interactions. Also, we have a special weight loss program. We have about five weight loss programs you can choose from depending on which suits you best, but all of them have the same goal to help you lose 10 to 20 pounds within 30 to 90 days. Very good program, and you can choose whichever one suits you best. So, this is the course format. It's for patients, caregivers, and family members. And the objectives is to empower patients and caregivers to safely manage medications, improve understanding of medication use and adherence, build skills to prevent medication errors and manage side effects, promote active participation in healthcare decisions. So, Module 7 Medication Management for Chronic Conditions. What are the learning outcomes? What do we want you to learn? We want you to learn how to manage medications for chronic conditions such as diabetes, heart disease, respiratory diseases. I want you to understand the long term importance of medication adherence. Why should you adhere to what the doctor tells you to do? So, we have the various topics, about 4 topics here, which we are going to be addressing now. So, the first topic managing medications for chronic conditions. So, the first and foremost thing I would like to let you know is that all chronic health conditions, if you want to manage them, it starts with a healthy diet, healthy lifestyle, and exercise. That will solve a lot of problems. So, healthy diet, watch what you're eating, have a special diet. You can always work that out with you. Healthy lifestyle, you know, limited alcohol, stopping smoking and things like that, and exercise. Now, when I say exercise, for people 40 plus, we don't expect you to be running, walking, moving. Even if you have to work in an office, walk around, find excuses to walk. Don't sit all day. Now, so the first one we'll look at is diabetes, which is a long term chronic condition. So it is so important to monitor blood sugar because if it's too low, the patient could, you know, go, hypoglycemia and faint. You should know how to use insulin. Now, insulin used to be only many years ago, only the type 1 diabetes patients used to use it, but now it's been found to be very helpful for type 2 diabetes too. So if the doctor thinks you need that, you might want to do that. And then we have the oral medications. You have to monitor that. You have to know the best dose. You don't want to go too low or too high. Then for hypertension, what do you monitor? How do you manage? Blood pressure medications. Weight loss also helps a lot in blood pressure management. So taking the medications now, taking them at the right time, checking to see what you can take with these medications. A lot of blood pressure medications have drug interactions. They have things you should not take with them. So you have to find out the blood pressure medication I'm taking. Is it okay to take this food or this thing with it? Things like that. That is what the medication profile I taught you to set up earlier on Those are where you can find out all those kind of interactions and what to look out for. And then for asthma and respiratory diseases, your inhalers, rescue medications. There are some medications that are for you to take so that you will not have attacks. But these medications will not work to stop an attack that is already in progress. You have to know the difference. You have to know which one is the daily um, inhaler or medication and which one is the rescue inhaler or medication. So it's very important to understand your disease and why you're taking each one of them. Now, what is the long term importance of medication adherence? So, when you adhere to your medication as the doctor has asked you to, you will be preventing worsening of the condition. Now, there are many things you can do to prevent worsening of the condition, but medication adherence is also part of it. Um, when you adhere to your medication, it will reduce hospital visits and complications. And then there's the importance of routine checkups. A lot of people in the US do their checkups every year, but just let it be routine, even if it's a year or every 2 years, so that you can know what's going on with your health. For those who are a little bit sicker, they might have to do their checkups maybe every 3 months or every 6 months. But it's so important that when you go for your checkup, you tell the doctor exactly what's going on because this is the time when the doctor decides to adjust your medication either up or down. So you want to let the doctor know what's going on. If you are taking your medication, are you taking it right? Are you skipping it? Have you started adding other things? Because this is something I see. Some patients are already using some herbal medications. They should let the doctor know which one they're using, how often they are using it, how much they are taking, so that it will help the doctor when the doctor is making adjustments to their medications. So keep track of symptoms when you are monitoring your progress. Use a journal or an app. Now, when you take your medication and you have some symptoms, it's always good to have a journal because you might forget before the next appointment. Have a journal to write down, what am I feeling? What time of the day do I feel it? What did I do before I started feeling this? It might be there's a particular food that triggers these symptoms. It might be there's a particular time of the day. Always write in a journal. You might even try to go back. What did I eat last night? Write a journal so that you'll be able to know if there's a pattern. Now, know the signs that medication needs adjusting. So, if, for example, there was a person I spoke with, the patient had been on a particular strength of medication for many years, but all of a sudden, it seems as if the medication was working too well. I think it was her blood pressure medication. And her blood pressure was going too low. So, for some reason, it might be that her body is not clearing out the medication as fast as it used to. So, there's an accumulation of the medication and making the medication more potent. So, these are the kind of things that you have to tell the doctor, oh, my blood pressure is getting too low. The doctor might have to reduce the dose because maybe your kidneys are not functioning as well as before. Or maybe it's the other way around. The medication is not working as well as it should be. The doctor might consider raising the dose or adding another medication so that there can be some kind of synergy. Now, so work with your healthcare provider to adjust treatment as needed. And this is where the journal or the app will be so useful to helping your healthcare provider decide what kind of adjustment needs to be made. So, caregiver tips for managing chronic illness medications. Stay organized with a daily medication schedule. Now, whether you're a caretaker or you're the patient, when they say take something once daily, if you take it at 7 a.m., let the next dose be close to 7 a.m. the next day. Don't take it 7 a.m. today, 10 a.m. tomorrow, 2 the next day. No, it has to be organized because once a day dosing, they expect it to be every 24 hours. Let there be a schedule. Stay organized. If it's twice a day, it's usually every 12 hours. So if it's 8 a.m. and 8 p.m., 7 a.m. and 7 p.m., something like that, organize yourself. Have something to remind you. And then the caregiver should communicate changes in condition to the healthcare providers. And this also applies if you are the person who is sick. If there's any change in your condition, let the healthcare provider know. There's no way they can know if you don't tell them. It's not everything that shows up in the lab work when you go probably every 3 months or 6 months or every year. So ensure refills are up to date and manage appointments. So, in the case of refills, you work with the pharmacy and the doctor's office. If you don't have refills, don't wait till for a week to the time. Make sure you maybe 2 weeks to the time you get in touch with the doctor, or if the doctor's office wants you to ask the pharmacy to contact them, give them time. Don't call the pharmacy when you're almost running out. This should be done ahead of time because sometimes the doctor is not around, sometimes the doctor um, is not as fast as they should be, depending on the kind of office it is. So give the pharmacy and the doctor time. Don't run out of your medications before you arrange for the refills. Also, the appointments, have a calendar so that you don't miss your doctor's appointments or your patient's appointments. So that concludes the um, module for medication management for chronic conditions. Um, if you want in-depth training, you want one-on-one training for your caregivers, you can always contact us at school.com/mywebpharmacist. And then if you have questions, you can join the school.com/mywebpharmacist community and ask the pharmacist questions there. You can raise your questions in the community and we'll be there to answer. If you're attending the live workshop, this is the Q&A time. And again, this is the My Web Pharmacist community bringing you this training. And next, we'll be going to Module 8. Module 8 will be coming up next. And this is about communicating with the healthcare providers. And what we want you to build confidence in discussing medications with your doctor, pharmacist, or nurse. I know people are not afraid to discuss with their pharmacist, but sometimes they don't know how to discuss with the doctor. So we'll be talking about that in Module 8. We want you to learn to ask the right questions and advocate for yourself or your loved one. So the topics we'll be covering in Module 8 will be how to prepare for a doctor's visit, bringing your medication list, questions to ask about new medications, understanding your prescription, what does it mean, the role of the pharmacist, how they can help you manage medications. So we'll be seeing you in Module 8 with these topics. Thanks for listening.